Hi, I'm Dr. Andrew Canakis. I am a gastroenterologist here at TidalHealth. I specialize in therapeutic endoscopy, also known as interventional gastroenterology. Gastroenterology is a unique field because you're providing acute care and longitudinal care for patients. For instance, if they're in the hospital and they have a stomach ulcer and they're bleeding, we treat that with a procedure. So we're essentially covering the organs from your esophagus down below, everything in between, if you will. We can do an upper endoscopy where we put a camera, we go down your esophagus, look in your stomach, the first part of the small intestine. If there's an issue with your colon, we go from the other end, a colonoscopy. And if there's issues, let's say with your pancreas, we now have an ultrasound scope and we can look around your pancreas, your liver, your bile ducts. One of my goals was to provide a service that is not offered here and prevent patients to going over the bridge for procedures. Starting in July, including myself, we had 2 other GI doctors, all 3 of us starting together. So now we're able to get patients in sooner for those diagnostic colonoscopies. We're capturing people who could be easily lost in the healthcare system with those long wait times. We're diagnosing cancers early, we're stenting them early, they're getting chemotherapy early. So we're one step ahead of the disease process, and TidalHealth is providing me with the resources to do that. The most rewarding aspect is having a patient thank you, because a lot of times we see them in their toughest time, they're stressed. They're under a lot of anxiety. Maybe they're not their most pleasant self, but we understand that. And being on the other side of finding out what's wrong with them and then seeing them smile is the best part. So our office is here in Ocean Pines. We provide services here in the clinic, our outpatient endoscopy center, and then for some of the more advanced cases, it's in the hospital in Salisbury. Ideally, patients would have a referral from their provider with a specific question or concern in mind, and then we can adequately triage it. With those referrals, we can quickly assign the patient to the provider that will provide them the best care.